What is chiropractic care?
Chiropractic care is the art, the philosophy, and science of helping the body function at the optimal level. That means helping the nervous system, that power from your brain, to travel through all of your body, through your nerves, to help all the muscles, nerves, joints, organs, and bones work at their top level.
What is an adjustment?
A chiropractic adjustment can be formed in over thousands of different ways. It can be aggressive and deep, or just light as a feather, the same pressure that you would touch your eyelid with. And what we do is move the bones and move the joints in order to take pressure off the nerves, in order to allow the body to function at the optimal level.
Is a chiropractic adjustment safe?
Absolutely, chiropractic adjustments are safe. We can work with babies just 3-4 pounds right up to patients that are 400 pounds. So we have different techniques for different folks at different age levels and different sizes in order to help them function at the best possible for them. An adjustment can be modified for those that are nervous to be extremely gentle, or those who are top level athletes and want to get those joints moving. We can modify it for them too. So there's something for everyone, and it's extremely safe and healthy form of healthcare.
Is a chiropractic adjustment safe?
Absolutely, chiropractic adjustments are safe. We can work with babies just 3-4 pounds right up to patients that are 400 pounds. So we have different techniques for different folks at different age levels and different sizes in order to help them function at the best possible for them. An adjustment can be modified for those that are nervous to be extremely gentle, or those who are top level athletes and want to get those joints moving. We can modify it for them too. So there's something for everyone, and it's extremely safe and healthy form of healthcare.
Does it hurt to have an adjustment?
It absolutely should not hurt to have an adjustment. There are different techniques for different people. We try and find those light, feather-like adjustments, and some people really like those aggressive techniques, but it should not hurt. There are cases where an area is really stuck, and that first adjustment to get things moving is sort of a wow sensation. Oh, that's different. But that part actually afterwards feels great. What does happen in about 10% of the cases is the muscles react. If you do muscle work, much like having a massage or doing a lot of exercise. After doing a lot of exercise, you're going to feel those muscles change. But that doesn't mean that it wasn't healthy for you. It's that your body is in a process of change and transition. And so we need to recognize those states and make sure that we can move slowly through your care in order to get the best results for that power source from your nervous system to function properly, allowing that innate flow of energy to allow your healing to be at the best level possible.
What should I do if I'm nervous?
If a patient is nervous about chiropractic care, they may have heard different stories from aunts and uncles or a friend of a friend of a friend. That's the time to do a free consultation. Come in and visit us, talk to us, ask your questions, relieve your fears with no obligation for care. And that way all of your questions can be answered. You get to meet the doctor that make sure you're comfortable with, and find out and discuss the techniques that you know that are going to feel comfortable for you, are going to be safe for you, and are going to be customized to you.
Can I adjust myself?
Many people like to self-adjust. They want to give a crack, and they feel better momentarily. The problem is they need to do this more and more frequently, and actually what happens is the area that they are self-adjusting actually gets hypermobile, means the ligaments get loose, and the joints that actually need adjusting get hypomobile, meaning that they get very stiff. So the best thing is to have an expert check the joints, check for areas of subluxation, so that your body can be functioning at optimal levels, and only the areas that truly need those adjustments are being adjusted in an expert way.
How often will I have to come in?
How often you need to come in to see the chiropractor is totally dependent on your genetics and your environmental pressures on your body. Some people need to come in as often as 3 times a week, or even 5 times a week if they've had an acute injury or a car accident. but most of us can aim towards once a week to once every 2 weeks in order to maintain our bodies in alignment. It's kind of like that oil and lube, that tune-up for your car. There's always a wear and tear on your body, and depending on how much wear and tear and how much you drive, depends on how frequently that you need that oil and lube. So each person is different and it is customized to their body, but we do want to make sure that it's functioning at least at once a week to once every 2 weeks for the majority of our patients.
Do children require chiropractic care?
Children do require chiropractic checkups. Now, each child is completely different. If there's a stressful delivery, even a C-section or especially forceps or suction, those children may need extra care. But if there's slips and falls along the way, especially around that age 1 to 2, every child seems to have a fall, children need more and more checkups. So what we do is we customize the program to each child based on how gentle we go and how frequent we need to go, based on their lifestyle, what sports they're in, how often they fall, what activities they prefer, and of course what their genetics are. What's happening with mom and dad definitely affects, and the stress in their household and their lives affects their nervous system. So we will make sure we do a full checkup for each child and make sure that their program is customized to them.
Children require chiropractic care?
Children do require chiropractic checkups. Now, each child is completely different. If there's a stressful delivery, even a C-section or especially forceps or suction, those children may need extra care. But if there's slips and falls along the way, especially around that age 1 to 2, every child seems to have a fall, children need more and more checkups. So what we do is we customize the program to each child based on how gentle we go and how frequent we need to go, based on their lifestyle, what sports they're in, how often they fall, what activities they prefer, and of course what their genetics are. What's happening with mom and dad definitely affects, and the stress in their household and their lives affects their nervous system. So we will make sure we do a full checkup for each child and make sure that their program is customized to them.
Is it okay to see a chiropractor if I'm pregnant?
Absolutely, we see so many pregnant chiropractic patients. In fact, it helps reduce their labor time, according to the research, by approximately 50%. That's amazing. So we have specialized techniques, special tables, special pillows. I know when I was huge, over 200 pounds, I could still get my adjustments to help make sure that not only was I more comfortable, but my baby was more comfortable. And the messages from my nervous system to my baby were functioning optimally. So chiropractic care is for pregnant moms and certainly aids in their delivery and in the health of their baby.
Are there many athletes that use chiropractic care?
Absolutely. We've worked with athletes. Of course, hockey is my favorite sport, so we've worked with Team Canada, but we definitely work with baseball, football, karate, curling, you name it. We work with all the sports in order to help athletes perform at 120%. When the nerves are functioning, that power from the brain goes to their muscles. You're going to have better reflexes, better strength, better mobility, better range of motion, so they can perform at the top level. It also allows them to recover from injuries faster and easier.
Is a good workout the same as getting adjusted?
A good workout is absolutely not the same as getting adjusted. Workouts work your muscles, help your heart, help your energy, help your VO2 max, but doesn't keep your alignment. An analogy is if you drive that car expertly and you drive it and drive it and drive it, is that the same as getting an oil loop? Is that making sure that the wheel rotation is good, that the alignment is good for the car? Cars need tune-ups, so do we. The more wear and tear we do, actually the more exercise we do, the more checks we need in order to maintain our proper alignment and help the nerves function from our brains, that power source, through our whole body, all the nerves to all the organs, muscles, and joints in our body. So exercise is fabulous. We need that to maintain our health. And the more flexible you are, maybe you'll be able to hold your adjustments longer, but it doesn't replace a chiropractic checkup.